Doctors Fred J. Phillips and David M. Shoemaker, general practitioners of Quakertown, Pennsylvania, recently completed a clinical study planned to determine the efficacy of a drug under differing physician-patient relationships. The study was premised on the recognition of two factors. First, that patients with gastrointestinal disease related to a troublesome life situation are benefited by a good physician-patient relationship. And second, that limitations of time and the daily pressures of living often make such a relationship difficult to achieve. We should like to quote from their paper, Peptic Ulcer Therapy Under Different Physician-Patient Relationships, soon to be published. We quote, 59 patients with peptic ulcers seen in the general practice of medicine were studied. The majority of the patients had duodenal ulcers, but gastric ulcers were included. 8 patients had gastrointestinal bleeding, and 5 were hospitalized. Most had been on previous therapy with unsatisfactory or equivocal results. End quote. All patients were treated with a combination of 400 milligrams of meprobamate and 25 milligrams of tridihexethyl chloride, Milpath, the dose being 1 tablet with meals and usually 1 or 2 tablets before retiring. These patients were instructed to follow a bland diet, and most also received antacid therapy. Not all followed their bland diet. When symptom-free, most ate as they wished. The patients were divided into 2 comparable groups, subjected to different physician-patient relationships. The 30 patients in Group 1 were given routine care. They were not told that they were receiving a new medicine, nor were they given extra attention directed at their emotional problems. The 29 patients in Group 2, however, were given extra reassurance and extra attention. They were told that they were receiving a new ulcer medication and that they could confidently expect relief of symptoms. Extra time was also devoted to a discussion of their emotional problems. We quote, excellent therapeutic responses were obtained in 90% of both groups. Symptomatic relief was obtained in an average time of 3.5 days in the group given routine care and in 5.1 days in the group given extra reassurance. The average duration of treatment for the group on routine care was 40.7 days, and for the group on extra reassurance was 41.9 days. These slight differences in response are not statistically significant and indicate that the tranquilizer anticholinergic combination was equally effective under both types of physician-patient relationship. End quote. From the results of this study, the authors concluded, and we quote, the essentials for the treatment of peptic ulcer, rest of both mind and stomach, were obtained with the aid of Milpath. It was suggested that although there is a very definite emotional component in peptic ulcer, unless thorough psychotherapy can be given, it's better to treat patients with a tranquilizer anticholinergic combination than it is to probe into their problems before medical care has been obtained. End quote. The tranquilizer anticholinergic combination administered in this study is available as Milpath. Each scored tablet of Milpath contains 400 milligrams of the tranquilizer Miltown and 25 milligrams of the anticholinergic tridihexethyl chloride, formerly supplied as the iodide. The recommended average dosage is 1 tablet 3 times a day with meals and 1 or 2 tablets at bedtime. The dosage should be adjusted to the individual and given with a bland diet and antacid therapy. Milpath is indicated in the management of duodenal and gastric ulcer, gastric hypermotility, functional diarrhea, gastritis, colitis, spastic and irritable colon, esophageal spasm, intestinal colic, and GI symptoms of anxiety states. Thank you for listening, Doctor. We hope you'll enjoy the selection from Schubert's Trout Quintet on the reverse side of this record.